So I'm Ken Rubin. I'm a nurse practitioner working in orthopedics. Over the last couple of years, we've started to work with some osteoporosis and osteoporosis clinic in my office. Usually it's about 1 day a week. There's a need in our community for that, so that's why I decided to start doing more on the osteoporosis side. So osteoporosis just means weakened bone, and if you do it by the DEXA score, they usually say anything over -2.5. So they'll actually do a score, and then below 2, -2, let's say, they call that osteopenia, which means your bones are starting to get thinner, but they're not quite in the osteoporosis category. So anything over -2.5 or greater, osteoporosis occurs in your bones where it actually looks like a spongy bone, not a nice strong bone, and that can cause you to have easier fractures if you have ground level falls. That means 4-foot fall and you fracture, that's a ground level fall. And you see some patients, they lose height as they get older. That's actually your vertebrae starting to shorten or even compression fractures because we have not treated your bones and got them strong enough in the first place. As some of you may know, you get this DEXA scan or bone scan done every 2 years after a certain age, usually around 65, unless there's a history of fractures or fragility fractures. You'll get this DEXA every 2 years and it shows your bone quality. And based off that bone quality, then you'll either be started off with just making sure your vitamin D levels are within normal limits, and we'll get you on vitamin D. Make sure you're taking your calcium or increasing dairy, depending on labs or what your DEXA scan might show. But if it shows moderate to moderate severe osteoporosis, or you've had a fragility fracture also during this time frame of osteoporosis checks that your primary may be doing, then you need to be seen by somebody's specialty, or some of the primaries will do this also. And that may include medications. And some of those medications are bone builders, some of those are just for bone sustainment, if you will. But if your numbers are low enough, or bad enough, if you will, then you'll need to be on a medication that actually builds your bone stronger for you. So we've seen a lot more in the last, I'd say, almost 15 years of people being lactose intolerant, or they just don't like a lot of dairies, and they never thought that was that big of a deal per se. And then now they're in their late 50s and early 60s, and we're seeing really large amounts of osteoporosis. So I think that's one issue we have, is that we're doing a lot better nowadays with lactose-free options for getting your dairy in your diet, or multivitamins, getting your calcium levels up that way. They actually did a great study actually showing just eating 2 Tums a day can actually get you enough calcium on most patients because of the calcium that's in that. So there's all kinds of ways, if you're just not going to drink milk, cheese, yogurt, ice cream, or you don't, or those upset your stomach, or you are a lactose intolerant person, there's all different other ways to still get your calcium. And then the vitamin D, we live in Michigan, obviously, and they did a great study about halfway of the United States up. Almost 60 to 70% of the population is low on vitamin D, because we get, maybe 3 months a year, if we're lucky, of great sunlight. And out of those 3 months, are we outside the whole time? Not really. So I'd be very happy to talk to any of you about osteoporosis. And if your primary care would like to have them handed over to me and I can help out or just assist in regards to keeping your bones strong, I'd be happy to do that.